And I have a severe tear in the rotator cuff and bicep tendon and whatever else is going on in the joint. But to be able to come in and move the way I'm moving now compared to 2 months ago is very, working with Leno and all the exercises and things, what we're doing, it feels a lot better. I can move my arm, I can lift it. I feel a little bit of the strength coming back to grab and pull in here.
But you're still feeling.
But still have some of the symptoms, yeah. And that's probably because of the muscle tear.
So one of the biggest things, and it's kind of the classic sign that you get with a rotator cuff problem, is pain at night with not being able to sleep, right? But that's gotten a lot better too as well,
Yes.
right?
Yes.
So that was like the #1 factor that we were really struggling with for a while.
That's a big thing, because sleep and rest, you need to sleep
to recover, right?
To recover, exactly.
Right, exactly.
Yes.
So the more pain that you're in, the harder it is to sleep, and the harder it is recovery. So you end up with this downward spiral, right?
Exactly.
So we've gotten to that point. So now it's time to make some tough decisions on what you do. But at the same time, it's not an emergency.
No.
Right? So you have time to make the decision and talk it out with everybody and figure out what's next. I'm obviously biased and hoping that we can keep rehabbing out of this.
Well, that's what I thought, I would ask you, your opinion of what a muscle tear is, since you have the expertise in this, and as far as where to go with it.
Yeah.
I mean, I didn't know that. I thought once it's torn, you're going to have to go in and sew it back together, or whatever they do. I didn't know it would heal on its own.
Right.
It has a chance to do that, depending on the severity of the tear, I guess.
Right, and like my boy Andy Galpin always says, it depends, right? So that's what we don't know.
Right.
And you don't really know until you actually move forward and go 100%, right? So what you end up having to make a choice between is like, where's your quality of life at, right?
Right.
So are you happy with where you're at and you're okay with doing these exercises and continuing to maintain, because you're probably not going to be able to stop doing them, right? If you stop, every time you're going to get a little bit weaker and tighter.
I think stopping would be probably the worst thing you could do at this point.
Right, exactly.
Yeah,
So, or then you dive in and make a full commitment on a surgery that you're never really 100% sure how it's going to come out. You got to make sure you find the right surgeon and all that type of stuff,
Right.
which is just a whole other process. But there's no absolutes, right? So you don't know what's going to happen 100% for sure.
But back to the problems I've had in my shoulder, I'm wondering if the scapula is not being held in place like it's supposed to. That's why it rides up. You get the shoulders a little off.
Right.
That's probably what's causing problems in the trap and the tightness and the other things.
Right, and it definitely does, right? So coming back to instability, when you start tearing muscles,
Exactly.
it creates instability in,
Yes.
in your actual joint stability and also in your movement. So that's what ends up becoming the problem, is that you can never get your movement back to really 100% normal,
Yes.
right? But at the same time, you can keep it at a really, really high level, right? That as long as you're able to override some of the programming, it's kind of like adding a new software program to your hardware, right? The problem is you just don't know what's going to happen when the smoke clears, and you're still at risk for injury,
Yes.
right? Or possibly.
Or
more
you could go
long-term
along, you might go, okay, hey, 4 months from now, you go in and you try to work out, lift something, and you could
Right.
tear it again and tear it worse. So
Right,
who knows?
exactly. Then you have the other side, you get the surgery, and maybe you're fine. Everything's all rainbows and butterflies. Or at some point in the future, you go to pick something up and it re-tears.
Yes.
Right? So that's like, you
That
still
I
don't know.
think is your body makeup, and
Sure.
some people.
Right. Well, it could be the surgeon. You never know. Maybe the
Yes, it
maybe
could.
the repair.
A lot of factors there.
Right. Exactly. That's what I mean. So
You get to the point where like some guys, they break bones real easy. Other guys,
Sure. Right,
Take-
exactly. And not everybody, you're a good student, you do all your stuff, which matters the most, right? So you
Yes.
have a better, higher chance of a good outcome.
yeah.
Right, either way. I think that's the cool part for you. You're going to do the work. So
I think
either way.
at that point you can't stop though. I mean, I think that's the worst thing to stop.
The other thing that made this a little confusing is Bob had neck surgery in July. Was it June? He had a cervical fusion,
Yeah.
2 levels. So the question was there there was some left-sided problems? Was that
Right.
The cause of what was going on? And you argue still that it's somewhat associated, but we obviously found out that you have an actual structural, what we would call pathoanatomic problem in the shoulder.
Yes.